I would like to welcome everyone to the Forum on Addiction and Healing. Opioid and heroin addiction is a public health crisis both nationally and in New Jersey. RWJ Barnabas Health has been a leader in attempting to combat this issue. I would be remiss if I did not introduce Connie Green, RWJ Barnabas Health's Vice President of the Institute for Prevention, and her team at the Institute, who have tirelessly worked to ensure these patients are getting proper treatment inside and outside the four walls of the hospital. Connie, thank you for the great work you do.
On behalf of the Partnership for a Drug-Free New Jersey, our chairperson, Elaine Pazicki, who's with us here today, I want to recognize the leadership of Senators Menendez and Booker for bringing this esteemed panel to New Jersey to provide a national perspective on a public health issue that is impacting hundreds of thousands of New Jerseyans and Americans.
People who live with addiction are not folks who are consigned to failure. They're not people who are morally bankrupt in some way. These are people just like any one of us, right, who have had bad luck and who have suffered an injury and illness, and who now need help getting back on their feet, and in some cases are on their feet helping others, and we should take inspiration from that. So I think that that cultural change is something that has to be a part of how we run our institutions, how we train our medical students and nurses and pharmacists. This is a moment where our profession can stand up and lead, not just within the walls of the hospital, but beyond it.
Here we are in New Jersey to discuss an issue that affects us all and has become far too common in the lives of our families and our communities, which is opioid addiction. With nearly 2 million Americans suffering from an addiction to prescription opioid painkillers, this crisis is affecting every community and nearly every family.
Your merger, Robert Wood Johnson and Barnabas, is really helping you come together as a community to be able to put these resources to do the types of things that we've done at VA, act as an integrated delivery system. Our New Jersey healthcare system in VA actually is doing among the best in the entire country. Nationally, 12% of all veterans are on opioids. In New Jersey, 5%.
When I left Boston, where I was practicing medicine, to come down to DC to start my job as Surgeon General, I actually went to say goodbye to all the nurses who I had worked with, who had helped train me from when I was an intern. And they said to me, Vivek, if you can do just one thing during your time as Surgeon General, please do something about the drug crisis in America. And I promised them that I would.
Don't just leave here and say Congress should do more. That's the citizen's body. To take some responsibility to saying, what, have I talked to my congressperson? Have I expressed the urgency that exists for the federal government to do something about it? Because as Senator Menendez says, this is not hard. This is not a matter of can we do something. It's a matter of having the collective will to do it.